Google the phrase medical tourism and you'll come up with pages of information and this basic definition: medical tourism, traveling to another country to receive health care. The term might be new to you, but the idea is not.
Medical tourism has been around for decades. In Asia and Europe, people have been traveling for health care to different countries, and the primary reason that they do that is in Europe and Asia for better health care in most cases, or more affordable health care.
Professionals who study and work in the industry say it's primarily because of cost that Americans are choosing to board a plane and seek treatment in other countries. For 2005, it's estimated 500,000 Americans ventured abroad to receive treatment, everything from cardiac surgery to facelifts to dental work. Yet there's some dispute whether this is truly a healthcare movement or a political tool or both.
Individuals who have no insurance may be seeking care in other countries, and that's getting the press. But in reality, there's no corporation, there's no corporate movement, and there's no movement on a large scale to actually send people overseas for care.
People are using the healthcare tourism and medical tourism as a symptom of a disease that's eating away at the healthcare system due to lack of insurance, and not as an opportunity.
The numbers vary as to how large an opportunity medical tourism is or will be for Americans. Author Maggie Grace, who witnessed firsthand healthcare in another country, will tell you it's a great option, but not the answer for everyone.
I have elderly parents, and I would be very reluctant to put them on a 16-hour flight or a 24-hour flight to India, regardless of what the facility was like there. Just the travel itself can be so daunting.
Besides personal obstacles, proponents of medical tourism say there remains in our society the ever-pervasive question of quality in foreign health care.
It's so foreign to Americans to think in terms of health care being available that's as good as what we get in this country, that it's available in some other country. That's just a foreign concept to most of us. It was to me. 3 years ago, I had never heard of medical tourism until I started investigating it with a group of our employees. One barrier is a public perception, no doubt. Second barrier is just the physical aspect of traveling abroad.
Some give better reviews of the options than others.
The quality of care in many international hospitals is very, very high. There are a lot of hospitals that are JCI accredited. There are hospitals that are not JCI accredited but have qualified surgeons who are either board certified in the U.S. or were trained and experienced in the U.S.
People who are medical tourists are at their last resort, right? So they're willing to forego safety, security, accreditation to go get a procedure for a low cost. So that's the market.
While opinions vary on the nature of the market, experts agree there are a number of barriers before there is a true globalization of healthcare. State licensing laws, legal liability issues, restriction on collaboration among healthcare providers, lack of follow-up care, and a lack of information are some of the hurdles.
There's not one place that you can go for this information. What you have is you have different websites for different hospitals, and you need to sift through them and hope that they're providing information on quality care indicators as well as outcomes on procedures. Most of the time you need to do a lot of emailing or phone calls to get some of that information.
Hurdles aside, most industry professionals we spoke with say medical tourism has the potential to impact healthcare within the United States in a positive way.
In my opinion, the real value of medical tourism is that it opens the medical community here in the United States to the idea that competition is available in other places.
Why would we restrict ourselves just to providing care from Americans? Why can't we think about a global market?
A global market for a global issue. For ICU.com, I'm Rebecca Fox.